Hey everybody, Evan and Irma here with Avira Health, and we're spending more on healthcare than ever and somehow getting more complexity, not necessarily better outcomes. Maybe the issue isn't better effort or innovations. The system was built to treat problems late instead of preventing them early. In that regard, we have a great guest today from Connect4Patients. Greg, how are you?
I'm good. Good morning, Evan.
Good morning. Great to see you. Really look forward to your story and mission, and I'll hand it off to Irma.
Yeah, so Greg, for people who are not familiar with Connect4Patients, right there on your website, you say, because understanding your health is the first step to changing it. I like that statement there. So can you tell us what problem you're trying to solve, what made you start this work, and anything else we need to know right off the bat about you and Connect4Patients?
Well, let me start with a little bit of my history because it'll explain why I'm kind of uniquely qualified to solve a problem that's been attempted to be solved now, I think, by the government with the recent Trump announcement, and I think it's time number 6. So I started, my career long time ago, unfortunately before PCs existed, so I'll date myself for a second. But let's just move it forward, and I was brought in to help drive the applications business at Oracle. It had lost its competitive advantage in its early head start to SAP. And when I was analyzing just the nature of what at the time didn't really have a name, later it was called ERP, the first thing that came clear to me is when you looked at the market, it was outsourcing. It was going away from vertically integrated supply chains like IBM would make, build the product, they would make the raw material, they would move the products themselves, they would sell the direct. And the world went to distributed systems. I've got a contract manufacturer, I have a raw material supplier, I have a logistics partner. Well, what happens when that shift occurs? The data you used to have is now spread out over lots of locations, right? So I decided back then that needed to change. You need to have the ability to capture all the data in real time across all the different trading partners. Oracle's senior management didn't quite understand that concept. So I chose to leave and went to a company called Intellection, which was a small consulting company that had a product it built for a customer, and we productized that, changed the name to i2 Technologies. And I was the president of worldwide operations and the CEO. It was an interesting market because supply chain didn't exist then, supply chain technology. So I can easily say that I was a main driver in the creation of that market that has yielded billions and billions of dollars of return. But I never forgot the original vision. The problem was the supply chain tools had the same problem. They couldn't see their contract manufacturer. They couldn't see their suppliers. They couldn't see the logistics partners. And yet they were trying to manage a supply chain to meet a high service level for a customer. So remember the word customer. So I created the first inclination of what's called a network at i2. We patented it. The patent's long since lapsed in the company that acquired that technology. But I decided I would do it one more time and do it right. And I started a company called One Network. Now, what was different about this was that it would take the data that was fragmented and create a single version of the truth in real time. And it would then propagate that data to everybody else that needed to know it, but it would put it in their language because, the OEM might want to see data in a certain way. The supplier needs to see the data, not just from one OEM, but from all their OEM customers. So it was a complicated many problem. Well, I sold that company. It did very well. It's now part of Blue Yonder Corporation, which is kind of interesting because that was my prior company. Most of Blue Yonder was my prior company. Circle's complete now. So when I sold the company, I decided that the single biggest problem to be solved in the United States and even globally, and most importantly, the thing that I could have the most impact on the world in the largest way that I could come up with was to solve the medical problem. So if you think about medical and you forget about how it runs today, so I use a concept called first principles on how do you design a system that can accomplish two goals. One is reimagine the system, but also secondarily, initially allow it to work with the existing infrastructure so you can get speed and adoption while people migrate to the next generation of systems. So that's what the concept was founded on. So let's define that for a second. So the medical industry is a highly fragmented data problem. That data problem causes huge administration cost. If you look at the total cost in the healthcare space, I was watching one of your other podcasts, by the way, Evan. You're quite a popular, or both of you are quite popular to watch. You know, a lot of people are throwing around the same number. The U.S. spent about $5 trillion in healthcare spend. Of that $5 trillion in healthcare spend, that's over 18% of GDP. That's up from 14. At the rate it's growing, it's insurmountable. The U.S. can't survive at the cost increases happening in the medical space. Well, the first and foremost thing that has to be solved is you have to have the ability to have the patient be able to help control their own life. The patient is an afterthought in our medical system. So let's think about what that means. So if the patient is an afterthought, and you look at the U.S. medical industry, it is a treatment-based environment. What that means is they fix you after you tell them they're broken. You're broken. In most other countries, they have preventative care processes in place. The U.S. is over twice the cost of any other country, yet it's one of the highest mortality rates in the world, yet we have some of the best teaching facilities and doctors anywhere in the planet. So you think, how can you screw something up so bad? Well, we figured that out. We figured out how to screw it up. So the underlying problem that has to be solved, which will allow significant value, and I'll put a number on the table that I didn't create. There's $1 trillion worth of savings just to do what I'm going to tell you. And that is, how do you bring the patient into the system and make it patient-centric? Okay, what does that mean? First thing is, all the data about the patient has to be in a single version of the truth. And that single version of the truth must be shared with all doctors that interact with that patient. Second thing is, the patient needs to understand his own medical information. So have you ever, I'm sure you've read lab reports. Do you know what a bun is? I don't know.
Well, Claude sure knows what bun is, and now I do too, because I've asked Claude.
Yeah, exactly. So you leave your lab results and you go to Claude and you ask them one at a time, right? Or you take a
of course.
really know how to use it, and it tells you, okay, so let's use that as an example. So if I want to be preventative, I must also go after the real problem in the United States, which is our food supply and our workout programs. 40% of the calories in the United States that are consumed are ultra-processed foods. There is no other country in the world like that. We enter into other people's countries and we make them bad by what we introduce. Countries don't want to buy our agriculture because they know what's in it, right? So eventually, the U.S. has to move to a preventative care system, and then you'll see a substantial reduction in cost in the medical system, because the number of chronic illnesses will drop drastically. So that's the vision. That's where you're trying to get to. Okay, let's get back to, how do you do it in the short term? All right, you have EMR systems everywhere, right? I mean, thousands of locations of medical records. In my particular case, I have 6 different doctors that belong to 6 different networks. What does that mean? I have
Wow.
6 different portals. Okay. Who is going to make sense of data spread across 6 different portals? Right? I have 2 doctors that I recently went to that prescribed me 2 different things for the same problem. They are in conflict with each other. So data fragmentation creates medical error and administrative overhead cost. Are either one of you tired of filling out forms?
Oh, yeah. We're all exhausted. I think all of us in our healthcare system are. Yeah.
We were hiring when we were making 50 to 100K monthly losses.
And why? Welcome to episode 1.
I can't think of a single founder who's been around for a decent amount of time in business who hasn't had their tunnel of year. This was that year. We're going to be okay, yeah, Sheree. Some are going to hear this and think, you TDP. But hear me out. You only have to do the math to understand that very soon we were $500,000 down.
Okay, so I'm not going to tell you the secret sauce of how we did this. There's a reason why the U.S. government has tried 5 times and it's never worked. But we've used AI, and what it does is it assembles all the data in a HIPAA-compliant way. It fuses the data together into a new single version of the truth. It cleanses the data to make sure it's accurate, so where you see redundancies and differences. But it can't solve everything. So let's say, Irma, you went to the doctor and you had a symptom. You went in and said you had headaches, and he said, sorry about that. Gives you a medication and you go home. Okay, that symptom's still in your medical record. Who else but you knows that symptom is gone? Nobody, right? So in a patient-centric app, what do you want to do? One is have the AI not just fuse the data, but put it in multiple languages. What I mean by languages is it already speaks doctor, so it says bun. Have it speak English where the patient can understand what the heck that is. But more importantly, how does it pertain to my medical record? So let me give you a fun story example of this. So I'm using bun as an example because I got my lab results. My lab results says my bun ratio was high. First thing I did was I asked my AI system, what the heck is a bun ratio? The second thing I did is I just told it to analyze my lab results, and it looked at my bun ratio and it said, it is high by normal standards. But Greg, you're on a preventative lifestyle program that's part of our solution where you're on a high protein diet, and that high protein diet makes your bun go up. And actually your bun ratio is right where it needs to be. My own doctor told me we have to fix this. Then I explained the situation to him. He said, oh, well, I didn't know that. Well, of course you didn't know that. You don't have that information, right? So, the ability to not just create the single version of the truth, get the patient involved to where they know what it's saying, and more importantly, it's always prescribing what to do. So let's say you're trending glucose levels, and you're not at over 100 yet, so you're not pre-diabetic. But your trend over the last 3 tests are heading over 100. Wouldn't it be great to know that and start a dietary and workout program to make sure you never become pre-diabetic and then become diabetic? See, none of that exists in the system today. So we fuse the data. We translate it into languages everybody can understand. It's a full AI built system from ground up. You can ask the AI system anything you want about your medical information. So I don't ask ChatGPT about a particular problem because it doesn't know my record. In fact, we have the only location where all records are located that are specific for that individual, because you can't put HIPAA data into normal large language models. So it can use the data that's researched, but then it can apply it directly to you. Anyway, that's a long answer on who we are and what we do to start.
Oh, Greg, this is fascinating. Of course, now I understand why your background and how you got to this whole supply chain problem and now applying it to healthcare supply chain being not of products, but of data, which is basically the key ingredient in this healthcare system. By the way, we talk about the system being broken, and then in fact, it's working exactly as designed. It just wasn't designed around the patient. So I've heard it said, well, the system is not broken. It's fixed to work a certain way. So I love your approach about putting the patient at the center, and also going way upstream, including the food supply and the diet and the exercise to try to address this problem of prevention. And the reason you mentioned, how it works differently in other countries is also because their system is fundamentally different from ours, right? So our health insurance is attached to an employer. It's not attached to a person. So there is no incentive for the health insurance companies to really support the upstream interventions or prevention, opportunities. So talk about that. Talk about more about what you can change in the system.
I love your points you made there. So a couple things. One is, the system is designed to be treatment-based. That has to change, right? If you don't get a patient involved, it'll never become preventative. But think about the data that comes out of this system. It will aggregate itself, anonymize itself, and it will determine what ingredients out in the food supply needs to be removed from our food supply. Which of the medical drugs that have been launched should be pulled off to the market because I see way earlier that this drug is not helping the market, right? Clinical trials have a way of managing a clinical trial around a set of criteria. Well, there's a lot more different use cases in the world than what they tested, right? So that would happen. But then when you look at the incentive programs you're talking about, everybody's kind of incented wrong. This is all about the more I do, the more I make. The more tests I get, the more I make. The more surgeries I do, the more I make. I get paid more if I do a surgery than if I don't put that person through a surgery. So the incentive programs are wrong. And let me tell you, the compounding effect of this is just embarrassing to see. So if you've got a patient who has a medical problem and it's diagnosed by the doctor and it's misdiagnosed because of medical error, primarily due to data problems, they're looking at bad information, that in turn gets that patient to file litigation. Then all of a sudden the litigation hits their insurance companies, they raise the premiums. Then it gets back to the doctor and he says, you know what, I can't survive if this keeps happening to me. So what do? What we call CYA testing. Cover your ass testing. You will test for everything, whether you need it or not. It compounds the cost of the system, and it makes it very difficult to work in. I was listening to your podcast, and I found a brilliant point they made. So many doctors are just wanting to leave because the system is not fun to work in. Our single version of the truth solves a lot more problems than I talk about. But another one it solves is how do you take a recommendation for a procedure or a test, say just an MRI, and get it to the insurance company and have them approve this? Is it not funny to you that the insurance company is making the call on whether or not the patient gets an MRI?
Well, they're literally practicing medicine without license.
Yeah. But then they do this on purpose. It's a manual process to enter into the data. Then they give you a response back. Then they have another form you have to enter back in again. All they're doing is delaying cash flow, right?
Yep.
Then it's a slow play. So the supply chain, the financial supply chain hurts everybody in the system. I'll tell you one trend you will see. You can write this down as a prediction by Greg, because we're starting to talk to people about this. You start to question, well, what do you need the insurance company for? You've got enough volume. Any state could do this today. Most cities, all large companies can just say, you know what? That 35% margin they're making, I'm keeping it. I now have a system that I can change behavior. So imagine this. We're talking to one state right now that we're going to do a project with, and they pay, they've got 35,000 employees. And since this is a full lifestyle system that includes dietary, workout, and medical, and it makes sure that they all work together. A workout program that is going to hurt my bum knee, and don't put me on a high-fat diet when I've got cholesterol issues, right? So it's going to mold everything into the perfect version you want to become, and even let you tell it what you want to become, and the AI will push you there. But when you think about that, what they want to do, which is brilliant, is a wellness program that says, I want you to follow all of these programs. If you do, instead of you paying $500 a month yourself, I'm going to give you half of that or all of it back. Now, if you look at it from their perspective, the faster they get to preventative, the amount of money we're talking about is far greater than a mere $5 a month. Right?
So you're talking about organizations becoming self-insured and therefore being able to design the entire program with the prevention in mind and reduce the cost overall, never mind improving the health of their population, right?
Yeah, my second prediction is, now that I said that out in public, the insurance companies will start to change their approach. They will say, we need to fix this, automate the system, be fair about it, quit taking so much money out of it. The pharmaceutical guys are going to have the same problem. Imagine if I get, millions and millions of people on this system, and we're on the road of fast growth now. We'll just start selling drugs direct, ship it directly to their home, right? So, the big cost buildups are the fragmented data is a ripple cost against everything. Everybody goes after the drugs because it's unfair that they're sold cheaper in Europe than they are here. Well, if you start taking the middleman out, it's adding on top of all the costs of that, you can substantially take down those costs. These are just free byproducts of getting the patient on the system himself, right? Manage his own world, reduce his own costs. Of that $5 billion, 500 million of it we pay, right? So, give everybody.
We the patients. Is that what you're saying?
We the patient.
So I love everything you're saying. I think Irma is very enthusiastic as well. It's just an amazing vision. Talk about getting this to the reality of our healthcare system with, the entrenched interests, the political protection that these interests have, monopolies in many cases, including the tech stacks, including the EHRs and other sort of monopolies. Right. What's the plan? Is it grassroots or can it be top down?
Great roots. If you remember, I started the conversation with two criteria that I call my first principles approach. The first is reimagine the whole solution. Okay, but you can't replace every EMR system in the world. It would take you decades. The second part of that, though, is allow that to occur, but embrace what's there and make it better. I added one more that was the hardest thing to figure out, and do it without having to run a project. Okay, so let's put that in perspective. I launched the product into the open public production environment, 4 or 5 months ago. Sold a lot of users already. I have 92% of the United States on our system today. Nobody is going to find out how I did that, but we have 92% of the people on our system right now, not the people, the systems themselves. We have 92% of the hospitals, the family doctors, the primary care providers are already on the system. Now, the other 8% is because there's small little vendors that do technology that just we haven't been asked for. And we're saying, if you got a new one, tell us, we'll do it for free. Our goal is to have 100%. Now, the beautiful thing about it, have 100% of something, there is no vendor big or bad enough to say they're not going to play, especially because they're in a bad situation. They should want to play. This helps their system drastically. Their doctors will love this, right? They do love it. But the reason it works, which I wish I had when I was supply chain, you own your own data, right? Whose decision is it that wants to say, I'll provide the data, or I'll allow you to fuse the data? Remember, it's all HIPAA-compliant information. So if the patient has the data, they have no way of stopping and shouldn't stop it, right? So I think personally, everybody will embrace this concept. They all got together and tried to solve it 5 times, and they did it all wrong 5 times. Definition of insanity. Do the same thing 5 times and still not get it right.
So this is all very exciting. As a patient myself, as a patient advocate, how do I get involved? How do I get access to this offering? How does the company take advantage of this? I know you have your app that is targeted for providers also, not just patients and patient advocates and families. So how do people get involved? Is this something they can start using? Or is it still too early?
No. We want everybody on system as soon as they just go to the App Store on either Google or Apple and download it. Now, there's 3 apps today. The first is the Healthcare Network. That is the secret sauce of how the AI system fuses, cleanses everything. Now, there are capabilities in that for the user to cleanse further the data. On top of that, so it will work standalone. On top of that, you got the patient-centric app. It's got a full-blown AI system built into it. And it's got the lifestyle app, which is the preventative care capabilities. And then we're even going to allow third parties to build other apps on top of the network. But those 3 apps are available in production right now, and we're out hitting the streets with it.
Brilliant. What are you excited about as this rolls out over the next weeks, months, quarters? What's on your mind, and what can this ultimately become, even beyond the amazing vision you've described today?
It's unbelievable to me that once you get a single version of the truth of record, and you can even incorporate, other data, your health, your lifestyle data, workout programs, dietary programs, etc. You don't need that, but if you have all of that. I've been talking to people in every meeting recently. They said, this is fabulous. My usual competitor is, that's too good to be true. Everybody else is trying that word. So I said, okay, fine, turn it on, use it. Pay me in 7 days if you like it. But they always come up with an idea I hadn't thought of. So I'll give you a perfect example. This smart young guy said, there's a real problem in the world for in vitro fertilization and alternative ways to have babies. And they have no way of matching these embryos or sperms and eggs and finding a surrogate if they want it, and to manage that process. There's no systemized way of doing that. I took it a step further and said, what about orphans? If you can get around the regulations in the United States, there are orphan children all over the world. And there's plenty of parents all over the world looking for children, and there's no way to bring them together. And they would need all the medical information of these to pull it off. So we now all of a sudden plan on building a solution for that. The solution to tie the the payment side in and automate that and force the insurance companies. I'd like to say that was my idea, but a couple of hospitals say, do that. That's major right now for me, right? So when you finally get, the real-time version of the truth, you can build so many apps on top of that.
Mm-hmm.
But then more importantly, what is amazing and what Trump's asking for in his recent program, Make America Healthy Again, he wants the data. He wants to know what right now with these fat loss drugs, to understand from an aggregate basis, just like the pharma guys do, how can I leverage this data and get better pharmaceuticals, get bad ones off the market faster, plan for, any disasters as before. So I think to answer your question, we're at the tip of the iceberg of what we can do just by adding this into the existing infrastructure of the medical backbone.
Well, on that note, we're all rooting for you. We all plan, at least here on this call, plan to sign up and introduce this to our doctors and providers and hopefully get them on board. And everyone reach out and go to the website, get the app. I hadn't realized you were so far along. And onwards and upwards. Here's to a healthier country and society.
One last thing I'll leave you with that'll be a fun thing for you to do with your doc. When you walk in with the app and you show it to him, and you got some prescription he wants to do, have him say the prescription and then ask the AI, will this impact any or have negative impact on any other prescription I have?
Oh, wow.
The doctor has to figure out every permutation of every drug. I got prescribed a sleep med, and it was affected by 4 other drugs I was taking. He had no idea.
Wow.
That's the medical error problem that they're dealing with. With that,
wow.
I'll let you wrap.
Huge opportunity. That sounds amazing. I'm going to try that. And thank you for what you do.
All right. Well, I thank you for giving us an opportunity to speak about it.
Yeah. And thanks everyone for listening, watching, sharing this episode. Also, check out our new TV show, TechImpact.tv on Bloomberg Television and Fox Business. Greg, you'd be a great guest there as well. Another conversation. Take care.
All right. Thank you, guys.
Thanks, everyone.
Bye-bye.